Brown, who is the Dean of the College of Nursing here at Southern University, who helped to organize this event. Let's give Dr. Brown a round of applause.
Thank you and welcome. When I got the call last week from Mr. Al Harrell, he was being very proactive. And that is what we aspire to do, instead of being reactive, to be proactive. So I want to thank him for initiating this initiative to inform the Scotlandville community about the coronavirus. We contacted Dr. Dawn Marcel. She is the Capital Region Medical Director at the Louisiana Department of Health, Office of Public Health, here in Baton Rouge. She's no stranger to Southern University. She has deep roots to Southern University. It is in her DNA. She is also part of the Scotlandville community. She is one of our own homegrown tomatoes, we should say. She has a beloved aspiration for the Scotlandville community, and without hesitation, she accepted our invitation to speak to you today. She is pulled in many directions, and she has a lot going on, as you can imagine, at the Office of Public Health, but her presence here speaks to her commitment to Southern University, the community, and the Scotlandville area. So we welcome Dr. Dawn Marcel to the podium, and we are so grateful for your presence today.
Hey, you know, when I was asked to do this, I had just finished something, was in the middle of something, on my way to the next thing. And I got an invitation, said, I got a call saying the Dean of the School of Nursing at Southern wants you to speak. So truly, without hesitation and without a plan and without a knowing how and without knowing what it would be today, because this has evolved every day in the last week and it is evolving today, I knew that I would. I knew that I would. And it's multifactorial for me. A part of it is I'm aware this is Southern's Founders Week, and I know how much my Spelman College Founders Week means to me. And so I wanted to honor Southern's Founders Week, but also the School of Nursing was the school for the deaf. And in my heart and in my mind, it will always be the school for the deaf. I still see my mama's second grade classroom window every time I walk by, and I know all the teachers on that hall still. And the dorm was there now, and going from the lab school, I would literally walk every day with the blind school in between. I mean, the school wasn't blind, but the school for the visually impaired. And this was, you know, in my lifetime, in my good memory, a recent memory, before when the schools were still actively segregated here in Louisiana, before they combined on Brightside Lane, and my mom went out there too. And she had a Girl Scout troop, a Brownie troop, and I was the only girl who could hear. So I had to learn sign language because I had to if I was gonna be in her troop. And so, and then there was Uncle Brad, Wallace Bradford, who was the principal with my Aunt Ereline, and so it runs deep. But even for me, the name of the building circles back to Spelman because of J.K. Haynes. Now, I'm a Spelman alumna, and I took my major classes at Spelman, but I have Spelman sisters who took some of their biology classes at Morehouse, and I don't know a single male physician who matriculated through Morehouse during the 4 years I was there who is now a physician or a PhD or something in physics or biology or chemistry who did not have J.K. Haynes Jr. as their professor. He is amazing with what he has done at Morehouse, and it was always a sense of, pride in a good way. A connection in a good way, to know that, to see all of that happening in Atlanta and knowing that it came from here, you know, and just having that tie in a very real way. So with that, being here today is a tie in a very real way. There have been many times when I have done work other places like Chicago, presentations in Amsterdam, working in Milwaukee, and my daddy would be like, what are you doing that? We got that problem right here. You can work on that right here in Baton Rouge. That's a problem at home. That's something at home. You can do that at home. Why are you there? And a part of my wanting to be here also is because so many of us from here are no longer here anymore. And so it is an honor to be back home and to be specifically to be here to talk about this. So let's do that. I'm going to do this a little differently. Any questions or specific concerns or comments before we get started? Yes.
I work in fitness and wellness here at the Rec Center.
Oh.
My concern is the level of frequency of cleaning, cleaning products, and with our equipment and sharing yoga mats and things of that nature, and often with our fitness classrooms, how often we clean the flooring and things of that nature. So that is one of my big concerns.
Okay. And that specifically may not be addressed in the presentation, but that is a very real and valid concern. And because it can spread, it won't live very long on those inanimate objects, but there is a window of hours where it can. Bleach products, hydrogen peroxide, ethanol products are really good cleansers. I mean, the question is the frequency of it, and I think to that extent, having the students wipe down before and have them wipe down again afterwards. I mean, in addition to what you do routinely, if you don't already do that, might help minimize spread through that route. Okay. So, U.S. CDC, Centers for Disease Control and Prevention, is closely monitoring, on this slide, it's an outbreak of respiratory illness caused by a novel, meaning new, coronavirus that was first detected in Wuhan City, Hubei Province, China, in December of 2019. Now, the first recorded case was in December of 2019. And that is a tremendously short amount of time for the prevalence of cases that we now have positive. And I want to also add coronavirus along with rhinoviruses are causes for the common cold. Coronavirus is not a new virus. It is a new type of coronavirus, but this virus was first identified in 1968. It was called coronavirus because the scientists who found it thought it looked like the crown of the sun in an eclipse, and hence corona. And even the beer itself, Corona, is after that Lady of Guadalupe in Puerto Vallarta because it looks like a crown. But it's not a new virus is the point I'm trying to make, although this is a new form of it. Okay, the slide of the map was as of March 5th, 5 days ago. Today is the 10th. That map is a little different. 5 days ago, where you see 109,500, actually, as of last night, it was 109,577 people, but I'm sure that number has increased between then and now, and so I know it's greater than that, but that number was 90,000 5 days ago. And the 3,800 people who have died was 3,200 5 days ago. And 2 weeks ago, actually not even 2 weeks ago, on February 28th, when I spoke about the matter, it was 40 known countries. There were no cases in Louisiana. There were no deaths in the U.S. The very first death was the following morning, Saturday, February 29th. And so it's rapidly evolving. But what I'd also like to point out here, with the 109,500 diagnoses and 3,800 deaths, there are a lot of people who have been not diagnosed who are still alive and receiving treatment. And we are actually starting to see people recover. This is all still new and actively evolving here. But I point this out right now to know that while this is very serious, people will get sick and there will most likely be deaths associated with it. Not everyone who contracts this virus is expected to die. Other way. So it was formerly referred to as the 2019 novel coronavirus. It's also SARS coronavirus type 2 because in 2003, the initial SARS is also a coronavirus, and these seem to have very similar behaviors. And The SARS is severe acute respiratory syndrome, and so the point is that it causes very significant lower respiratory disease. COVID-19 is the name that it is going by, and that's for coronavirus disease, and the 19 is that it was noted in 2019. Again, a large family of viruses and common for colds and people, but also animals have it. And it's believed now that the first case in Wuhan was from an animal, a seafood market, and it was zoonotic in transmission, which means that it was believed to be in animals first, and then a human contracted it, and it has since developed human-to-human spread. And that's a zoonotic virus, and it also behaves similarly to SARS and MERS, which is Mediterranean, similar virus in the Mediterranean population. So the U.S. reported its first confirmed case in January 30th, and as I just said, about a month later on 2/29, it was the first death in the U.S. Person-to-person spread was first reported among close contacts of returned travelers from Wuhan. And I also want to make mention that for people who have been traveling, the U.S. has been monitoring travel. Commercial airlines have reduced domestic flights. Everybody, if you're not a U.S. citizen or if you weren't an immediate family member, you could not come back. If you were in Wuhan or someplace in China where there was a high risk, you were rerouted. There were 11 U.S. airports. The closest to us were in Dallas and Atlanta. MSI New Orleans was not one of them. And if you were found to be suspect or they were screened, they were quarantined, and then everyone else who was allowed to pass through because they passed the screening, if they came from China, initially, at the beginning of February, they were monitored by our ID epidemiologists, and anybody who comes to that airport or comes through here is tracked and comes across my desk. And we are watching them right now. They are in isolation or voluntary quarantine, but we do keep in touch with them. We do track, we do monitor. And there were recent kids in our area who had traveled abroad to Italy, which is also high risk and now under quarantine. It is expanding, and I say is expanding because this is still a very much evolving process, but we are noting and watching them too. And I'll get to a slide later, but China, South Korea, Italy, and also Iran are travel 3 areas, and so travel there is really restricted. Japan is travel 2 as of now, level 2. As of now, we are still level 1, which means you want to pay attention, but right now we don't have any unrestricted travel, at least via air. You guys are probably aware that in the last day or so that the U.S. State Department recommended no cruises. Oh, and as of yesterday, we have our first presumptive positive case. Now, what time is it? Okay, so because really, if I gave this an hour, if I gave this literally 24 hours ago, that slide would have said nobody. That's how this is evolving. And so now we have a presumptive case in Jefferson Parish. The patient is hospitalized in New Orleans. We in EBR in Region 2, our surrounding area, are still negative, but we are testing. Presumptive positive cases are treated as positive cases until otherwise proven, and otherwise proven means the specimen is sent to CDC where it is formally tested for the gold standard, if you will, and that will be reported back to us. And I say that will be reported back to us because we have not received that yet. This is that new. Yes. Mm-hmm.
Transfer that person from Jefferson Parish to the VA hospital. Isn't that a haven for elderly veterans and that kind of stuff?
Well, what we don't want to do is speak too much about any individual patients, and when it comes, or people who have been identified as presumptive positive, until we know more information. Right now, this is an active case. We are still collecting data as a state with the ID epidemiologists reporting to CDC. And while we believe it will be positive, we don't know that it will be. So we are still literally waiting to find out what these CDC results will show. The VA population, VAs are very broad. While they are not pediatric patients, the age range is very broad. And so where in the hospital, any other underlying medical conditions that we're not aware of, there are so many other factors that need to be determined and identified before a statement such as that can be made. But that is on the radar, and as we get information, hopefully we'll be able to answer that more specifically. Anything else at this time? Okay, here we go. So, total cases, let me tell you, this number is a moving target. There is absolutely nothing absolute and written in stone about this number. It depends on who is telling you and when and where. And the time I watched the news last night on CNN, it was 7:17 when I started and 7:26 when I turned the TV off, or at least changed it from the news. I don't know where they counted from, but I don't believe it's totally off. What I do know is where I got mine from. And I go to the CDC website as I speak in this capacity. But I will make it clear that CDC from the start has had two different forms of tracking. The initial numbers that were reported as 14, when you would hear early on there were 14 deaths, 14 cases in the U.S. before death. That was based upon cases that were identified, tested, and diagnosed for people who were in the U.S. But even at that same time, we already knew that there were American citizens who had been repatriated who were positive. And so we've always known that number was more than 14. Also, I will tell you the CDC website is updated every day at noon, and they may have our presumptive case reflected now, but they may not. As of last night, we still would have been clear with 0. This is how fast-moving and actively dynamic the situation is. But at Washington State, on CDC's site and World Health Organization, I go back and forth between both of them, it will say 128 cases. The governor last night on the news says 160. When I look at the Seattle Times, it's 160. When I look at that was last night. It could be more today. And so, again, as long as you know what numbers you are following, the source of your numbers, how they are derived, if you are tracking, because there's a lot of variability depending on the source. And even if you are consistent in your tracking right now, it will be changing. It will be changing. As of yesterday, CDC tested about 4,000 people, and then nearly 4,900 people have been tested in U.S. public health labs. LDH OPH does have a state lab. Our lab is located here in Baton Rouge, and it is validated as a test site. They're good. They can do it. Until yesterday evening, there had been 15 cases that had been tested in our lab, 14 of which were negative. CDC knows all of this with us, that one became presumptive positive, and again, we are waiting. Now, but again, this is something different between yesterday and today and still evolving, because now you are beginning to have private entities that are now being allowed to test. I mean, initially, if you tested or if you had a question, you had a concern, you called the state lab, and the state lab is still here, but we had a specific courier service that would pick up the lab in a certain way to ensure integrity of the specimen, to increase reliability of the results. Now you can get testing at LabCorp, and Quest Diagnostics is also offering the test. Now, my understanding is that Quest is not up and running today in Louisiana for this, although they are in California and some other states and are expected to be tested here as well. Just to comment on testing, Well, let me ask you a question. Any thoughts about testing? I want to know what you're thinking about. Yes, yes.
In the testing, are they determining specifically by ethnicity and the effectiveness of the diseases affect us differently than other races?
That is one of the questions, but not necessarily in the testing. That's not necessarily a test question, like if you're coming in, but with the sample that is submitted, CDC has very detailed forms, and that information is a part of that. And along those, this is an aside, but there is an Obama initiative called All of Us to create a more diversified database. And while that's a separate conversation, because of your question, I'd like to have that with you following this. Yes. But I'm just curious, for my own edification, how many people are interested in being tested? Not really, you thought about it or wonder? Yes. Well, we have guidelines, and the guidelines have also been changing every day. Who's eligible today wasn't eligible necessarily last week, and I don't think anybody knows what tomorrow will bring with this. In general, and this is the difference between public health and personal health, because what I address are general guidelines for the community. And in general, if you have a fever, a technical fever, 100.4 degrees Fahrenheit or Celsius, and a real one, not under your arm, in your ear, or oral, like a true fever, you're coughing, you have lower respiratory disease, not necessarily exclusively upper, it may be both, but you need to have some elements of lower respiratory disease. A week ago, you had to be in the hospital, you had to be hospitalized. That was last week, this is today. You had to have a known exposure that was test positive, or you had to have physically traveled to one of, specifically China or South Korea, or one of the high-risk areas. Those are general guidelines, and for the most part, we are still adhering to them. I mean, that's what we recommend. But what I say for the most part for is because it is my earnest hope and expectation that when you are with your physician, that this individual is treating you. And if you don't fit under the guidelines for everyone, that if you don't need it, you won't be tested unnecessarily because you don't want someone who needs it to not be able to get it. But that if you do need it, whether or not you look like the bookmarks, that your physician knows your past medical history and is capable of examining you accurately enough to be able to determine, to assess on the spot whether or not a test is indicated in you. And that's the balance between your personal medical health and public health. Do most people, or do people in the room have a doctor, a PCP, or? Okay, well, say thank you, because that's not everywhere I go. So that right there is a blessing and a wonderful thing that helps, because, yes, ma'am.
Even though the majority of people often have a PCP, given the scare,
Yes.
it takes a long time for a lot of people to get in with your position. A lot of people are complaining about that, and then a lot of people need to get guidance on what they're supposed to do when they go to these urgent care. Because a lot of people opt to go to urgent care because you can't get in to see your physician quickly. When you start feeling bad and you feel like you just have the basic stuff, you go to the urgent care. And a lot of people who work here have the ability to go to urgent care for free, so a lot of people take advantage of that. So what are you supposed to do when a person goes to the urgent care or a similar situation versus you going to the doctor? Because if you call your doctor and tell them you're sick, unless you're about to die, a lot of them won't get you in right away.
Okay, look, Tracy, hold up right there, because that's packed. It's a lot of answers to what you said, because you were right, and there are a lot of different things. Yes, exactly. I mean, that question, I don't know if you heard it, but that was a very layered question that people are dealing with. And when I say people are dealing with, I mean the patients are dealing with, but also the providers. And I want to add that you know, the providers, this is still new for them too, and working through this as well. I mean, providers are very, very concerned. Do they have the PPE, the personal protective equipment available? Because they don't know necessarily who's going to have the virus or who is not until the test results come back. And yet they are exposed front and center. And so there are multiple reasons why you may not be able to readily get into your doctor. And what I was actually getting ready to say is that's when it is your PCP. Sometimes even if you can get into the office, the partner doesn't know you like your doctor does. And so you want to be able to know that the provider taking care of you knows you, but that's not going to always be the situation right now. Actually, it is being recommended that you not go to emergency rooms and urgent care centers unless you are truly sick. If you just afraid or feeling fearful, it is asked that you sit it out and try to call your doctor, but even the lines are loaded. And so some of that, while those are our general guidelines to have people to not rush to the doctor's office, I am thinking every doctor is going to know how their office runs best, whether or not they're a PCP, working with their office manager to know how to respond to their patients, because it's going to be different if you're an OBGYN or you're just GYN and you're dealing with older females as opposed to if you're a pulmonologist or a cardiologist or an FP. You know, your patient's needs are going to vary. And so that is evolving too. In general, though, we are asking that if you are really not sick and you don't have to go, don't. Because even if you do and you're not that sick, you become an index case that can make people who weren't otherwise sick ill. I mean, it is a balancing act that is truly working out. I mean, unfolding before us. Yes.
Hi.
Hi.
My name is Eldridge Etienne, and I'm the chairman of the board of the Baton Rouge Primary Care Collaborative.
Yes.
And I have a question. I see Mr. Matt Valera is up there too. He's the CEO of Care South.
I know
so
Matt,
I think
thank
we're
you.
probably going to be asking about the same kind of thing. Primary care facilities like we have, what role do you think they will play in the overall, this overall path to wellness and protection of the community? Because we serve people who are insured as well as people who aren't. So that, you know, there's certain members of the population, of the community that can come to us that may not be able to go elsewhere. The Baton Rouge Primary Care is located in the Jewel Newman Center, as well as
yes.
our office in the Bishop Ott One Stop Center as well. So
And the Bishop Op Center site, we know, is where homeless individuals can receive care, and that's a big deal. I mean, to my knowledge, that's the only place in this region where you can be homeless and actually receive care with validation of the status of your homelessness. And even with FQHCs, I mean, which will provide care for people who may not otherwise get it with or without insurance, public or private, there is still sometimes a sliding fee, and it doesn't always go to zero, and it can still be prohibitive. But, you know, we try to work through all of those things. But to answer your question, I mean, I do think that from what I have seen, I don't know that because that money is not administered directly through my office, but what I have seen is, and I would expect, is some of that recent money, that $8.3 billion that Donald Trump signed for this coronavirus fight or protection. I think that don't say I see it, but I think that some of that money will be allocated specifically to FQHCs and rural health centers, which is also a special category of government-funded sites to help provide primary care access to people who truly would not otherwise get it. And so I think that there will be some routes to the money there. And I think also, what can you do? I think a part of that will involve building on the relationships that you already have. You know, and with the provider knowing where your patients are coming from and where they're going, especially if they're new. And also, we have resources available on our website, and you have some handouts that you can take back and photocopy. And just being sure that people have information available when they are coming through and passing through, because not everybody who is going to come through may make an appointment at that time, but they still may be able to come through and get some information. They may walk in to schedule an appointment, but you're full. But in the meantime, before they can come back, being sure that we are here to help support you with information most up to date as we have it at any given time. But I do think some of that $8.3 billion will be allocated to UHCs and rural health centers. At least I hope so.
Good afternoon. You said that the private entities are now being permitted to test individuals. How soon are they obligated to report these cases? And are these people being told that they need to maybe self-isolate until the results are?
I don't know what they're being told. We don't enforce, we don't regulate that as an agency, and that literally is happening within the last 24 hours. If you want to know the answer to that, I can give you my contact information, and we literally will see how that unfolds. I mean, I can speak to how they do it at the state lab, but I would have to call back and find out what are we doing, because I personally can't imagine couriers going to all of these sites, and who's going to be ordering all of these tests, and will people be able to walk up? And also, it is my understanding, this is unofficial, I'm not speaking on behalf of OPH with this one, but Bill and Melinda Gates Foundation is working with the corporation to do home testing. And so I'm sure that will also influence the criteria for testing, who tests when, how to interpret results, who is interpreting results, what is the turnover time. I mean, if you do that, a physician may not even be involved. You're positive, and then what? I don't know. This is that new, but I'll give you my card because I actually want to know as well. And as it evolves, because I also think that's going to be a developing thing, because the other thing too is right now this is done through funding with CDC, but when you start involving many private entities and labs, I don't know what impact this will have on cost as well as access, and I think those factors remain to be seen. You're welcome.
Good afternoon.
Hi.
What type of treatment or treatments are being used or being given to those who test positive with the COVID-19?
Okay, well, the general answer is supportive care. And what I mean by supportive care, oxygen, things literally to help you breathe. We do not have any specific medications right now that are directly aimed at treatment of coronavirus. But there are antiviral medications that have been approved for other viral-induced diseases, and those are being used on a case-by-case basis with the doctor-patient relationship. We are not making any formal recommendations in regard to that at this time, but those are happening. I can say there is active pharmaceutical research and development ongoing right now in that arena, as well as active work towards vaccine development. But as of now, there is no vaccine, and there are no specific FDA-approved medications to treat this coronavirus, this 2019 novel coronavirus. Yes. I have to think about that. Yeah, so they can hear the question.
Oh, with your educated guess, you think they could come up with a cure for this within the next year and a half?
Well, while I think about it, I'm going to ask one or two people in the audience to give me your thoughts on it. And as I think about it, I will also qualify it. Cure is one thing and treatment is another, and you can treat without necessarily curing. And while there may not be a cure, there could be a method of treatment, or there could be vaccine development. And look, 18 months is really short for vaccine development, but doesn't mean it can't happen. And it could be preventive. It may not necessarily make what is already present go away, but it could prevent future cases. We don't know where this is going. We are literally tracking this now as a start. It could be seasonal with and have a mold on a curve, a bimodal curve. We don't know. It could look like the flu and be resolved next month. What is the summer going to bring? Or it can be like some other viruses and peak in August. We are still following those things as well. But cure versus treatment, I don't use interchangeably, and I don't know about a cure, but it is my earnest hope and expectation that something between then and now can at least happen to treat. Any thoughts about that from the audience? Are you like, you Yep.
You want to speak into the mic so they can hear you? They can't hear you.
Now, I was saying if China can build a hotel in 2 weeks, we can find a cure in 18 months. But right now, they're going to have to make a little money off it because everybody's scared and nervous and all that good stuff. So just like with cancer, that's my position. I'm a little off, but that's how I think.
All thoughts are valued. Anybody else have a thought about it?
I have a question.
Go ahead.
How long does the virus last once you've been tested and it's positive for those who do?
We don't know yet. We're still watching. We're still tracking. We are starting. I think we are starting to see where some people who have had it are symptoms are resolving, but it's not been tracked, and it's not been a group large enough to be able to answer that question with the specificity and expectation right now. We are still figuring that out.
Good afternoon again.
Yes.
So what are the recommendations for testing? Because where you may not have this COVID-19, you may just have some chronic sinusitis or bronchitis that resembles that you may have a temp of 100.4 and some of the other symptoms. So
Well, that actually goes back to the question that the lady behind you asked. With it's still the same. I mean, if the 100.4, 38.4, lower respiratory disease, it had been if you've been hospitalized, but these are evolving. Now, when you bring in the other things, like if this is sinusitis, ideally, hopefully, some of that is when your doctor knows you, but as it was brought up, you can go into urgent care and that person is a stranger to you and you are a stranger to them. But as a physician, it's my hope and expectation that we can ascertain and know how to. I may be biased, but it is my hope and expectation that as a physician, we would be able to assess a patient to analyze how to treat once we've done everything we were supposed to do. Now, I'm just saying. But with that, what we are also learning is that if you have been identified to have, let's say your sinusitis is caused by an identified bacteria, or if you are tested for the flu and your flu is positive, what we can say now, what they have found, is that there's rarely concomitant infection or co-infection. So if you are found, let's say you screen for one of those things, it comes back positive, right now it is highly unlikely that your coronavirus would be positive if you have been found to have something initially on assessment. Now, that's a little different from the other question about the general guidelines, because when you bring in, like if there's another diagnosis, another identifiable cause, viral or bacterial, it's usually not coexistent. That's so interesting to me. Yeah.
Thank you. Deidre James Mackey. I teach on the campus in biology and in the Honors College. Mm-hmm. And so I'm concerned as a microbiologist and also as a professor on the campus. Now, my concern to become proactive, my students are very concerned, and so they're wondering whether they should just get tested. As well, they're wondering if the university should be proactive and go online. So they're trying to, let's say, get ahead of the game to make sure that perhaps, let's say, the university addresses, let's say, worst case scenarios. And so I'm trying to see, any of the panelists certainly can answer, but from the perspective of the university, since we're all dealing with each other in a close environment, and when we talk virus, that's, it's possibly an imminent phase that it can be easily contracted. So if you could address that, thank you.
I'd like to introduce to the left of me Dr. Greta Wilkes. She serves as the director of the Student Health Center here on campus. And she is very dedicated and committed to the welfare of our students, faculty, and staff. And she's going to share a little bit about the initiatives and the task force that is in place here at Southern University.
Hello, everyone. Currently, we have been meeting on a regular basis, on a weekly basis. If you've noticed the guidelines and the communications that have come out, providing guidelines for travel, we follow Office of Public Health, Louisiana Department of Health, and CDC guidelines. So any testing recommendations that would be required would be according to those guidelines. We stay within the guidelines that we receive. That's what we have disseminated. Because it is a fluid environment, we are ever changing. So we meet weekly, we will send out updates as needed. Right now, if those criteria are not met, meaning a direct exposure or travel to a classified level 3, level 1 or 2 area, if you notice those communications that went out recommended self-quarantine if you meet certain criteria. They recommended self-monitoring, and then if symptoms develop, that's what we have disseminated to the student body and the employees. There will be a post-travel questionnaire that will go out because we know spring break is coming up, and we will be allowing employees and students to fill that out online so that we can monitor that information and then follow the guidelines going forward with Office of Public Health. And I do want to thank Dr. Marcel. She has been in direct contact and very supportive. So I feel comfortable about what we are preparing. The departments are meeting to have a system in place in the event that we do need to self-quarantine in any area, or also academic-wise, we have also made recommendations for going online, being able to do that and provide that information. So you will see a lot of information coming forward in the communications regarding that. Thank you.
And
I'm sorry, we're scheduled to go to, with the National Quiz Bowl team to California. So we know it's somewhat of a hot spot. So the question is should we go?
When is it?
It is the March 28th through April.
Where in California?
1st. It's in LA, Torrance.
Okay, I'm gonna defer and then
So, I mean, I just need help. Do I need to pull my teeth back?
can y'all forfeit the quiz, the round, and
And I will share that we did cancel a recent trip with the media department to New York because it's university sponsored and you are taking students in a known area. So our recommendation is to use an abundance of caution on university sponsored trips in those areas.
And as far as academic preparation, our faculty are actively engaged in both face-to-face learning and online learning using Moodle platform. So our faculty are already prepared. If we have to go in that direction, they are prepared to deliver in an alternate format using an online methodology.
Thank you.
you know what else too, just to your students. I mean, they're biologists, they're budding biologists, right? Or many of them?
The team is multidisciplinary. However, our biology department was scheduled for a conference actually for March 25th. Then we were going to leave and go to LA. So the other conference, which is a scientific conference, Beta Kappa Chi, it has been canceled. And that was in Alabama.
So, okay, so you told me that. So, moving right along. But what I would do is, I mean, because this is biology, they're probably going to be asking you a lot of questions, and there will be a lot of things microscopically and on a cellular level that you will understand and that they will understand that many people won't. And so the thing is to honor their concerns, provide the information, but, help them understand or appreciate the difference between concern and worry versus fear, and just guide them, accordingly as we learn new information, because understanding is good, and I would imagine this is fascinating. But at the same time, we don't want that fascination to induce fear. But this is still an important situation that is rapidly evolving, and just choose wisely.
I'm reading it.
They have spoken, and we stay in touch too. So anything that comes up, any update, if we get any changes, and we make recommendations, but certain changes are like that are going to come from the governor.
Hi, my name is Stacy Armelin, and I work in the law center. One of my primary duties is travel. We have students who just came from Berkeley for a Latino conference. We have students preparing to go to DC. Should we be overly concerned about these students going to these high-risk places and returning? Or should travel be stopped at this point?
I'm going to
Every day.
I'm going to let Dr. Wilkes speak again to say that first, because she's with the university system. So in that sense, I think she is more appropriate.
Our concern, and once again, I have not spoken with anyone with the Law Center with what those recommendations or guidelines would be, but our concern would be proceeding with an abundance of caution. If you're taking students to an area with known positive cases, there is potential risk there. And recently, we did advise or agree with the recent group that was going to New York City, and the cases actually doubled from the time that they canceled it in that area. We're going to New York. And once again, because it is university sponsored and you're taking students, then that abundance of caution, I would advise you, and we can talk and discuss further, to really think of the safety of the students if you're doing a university-sponsored trip in an area where there is known positive cases.
I guess I just have a comment, and it's not so much a question as it is a comment. As we talk about, do we take students here, do we take them there, regardless of whether it's a university or not, the question that I would ask is, would I let my child go to California right now? No, because California had such a high rate. Would I let my child go to Washington State right now? No, because it has such a high rate. So for me, it's not a question about university policy. It's a question about, is it the right thing to do? Do I feel like I would put my child at risk, so why would I put any other child at risk?
Well, and that's a good point. But as a physician, I would always say, if this were my child, what would I do? When I know what's available, when I know what insurance will or will not pay for, how do I make the recommendation? And along that principle, I agree with you wholeheartedly. I've lived it. I still do. But that doesn't change the fact that it is a university group, and there are different ramifications and responsibilities and liabilities and costs that don't apply when it's your child, and you can say no. And depending on your child's age, your child can still choose to go. It would be great if it were that simple and cut and dry, but unfortunately it is not. But that is what I would say. Would I do that? No, but you have to look at we're talking about risks of disease, but you also have to look at the risk-benefit ratio for the purpose of the trip, who's going, how many people, where are they going, what phase of this and this. I think cost can be a factor for some people, and so I think it involves a dialogue with a plan to know what that answer is, and it can depend on what group is going, where, and when. But I do like that. If it's my child, would I let them? Or if it's my parent, what would I want?
Thank you, ma'am. Today has been highly informative. But my question is, since the detection of the coronavirus, How is that in comparison to people that have contracted the regular plain old-fashioned no-name flu that thousands of Americans die of every year? And according to the CDC, thousands of Americans have died with contraction of the regular flu versus the coronavirus today. What is being done about that? Because it seems, yes, corona is the sexy thing to latch on to, but people died from the flu before this, much before this, and probably during after. So why the big push for corona instead of, I guess, the known flu that we have?
Well, I can't personally answer that because I can assure you that LDH, Office of Public Health, is just as concerned about the regular non-sexy flu as we are about coronavirus. So there's no bias from us. But I was invited to speak about coronavirus and not the flu. But having said that, I highly promote flu vaccination or immunization to prevent contraction of the disease. You know, and you are right. I mean, like looking at the mortality of flu, it is always out there, and flu changes still. Even the regular flu changes from season to season. And so last year's flu is different from this year's flu. We'll probably have some variability from next year's flu. And we recommend that. I am floored by the novelty of washing your hands in the middle of flu season. I was like, we weren't doing that? And it's flu season. And people have to agree to take the flu shot. Now, with the Office of Public Health during flu season, we offer it at no charge to anybody who comes to any of our health units. During flu season, you can get a flu at no charge to you, with or without insurance. And if you can't pay the $10 administration fee, we cover that, we waive that too. So it's not that it's not access and people can't get it, but across America, the immunization rate for adults for flu vaccine is a little under half, at 45%. And so I think a part of it is just keeping those active campaigns. We haven't stopped. We just can't make people do it. But we do have it available. We do have it accessible. In November, we had a mass flu shot event. I mean, we gave flu shots all day. We shut everything else down just to give flu shots. And so we need to advertise that more here so you guys can know, and so that people who are genuinely interested can come by and know in advance. But I'm glad you brought that point up, because the flu is no less of a serious concern, and technically we are still very much in flu season. Yeah. It's March 10th. We're in flu season. And here in Louisiana, it started early. And so we have been watching our cases. And so, I mean, coronavirus has gotten far more publicity and media attention, but please know that this is not more or any worse than, and that the flu is still real. And we have been recommending, while the flu shot will not cure or prevent or treat coronavirus, it takes about 2 weeks to kick in. And for people who had not been immunized, we were still recommending the flu vaccines if people were interested.
Hello. My name is Branicia Williams. I'm a student here at Southern University.
What are you studying?
Criminal justice. I'm sorry. Yeah, I'm a criminal justice major. I see up here it says that the droplets can land in mouths and noses. How long will it last? Like being here on campus, we move from class to class, different buildings. Sometimes we go from here to home or here to work. Like from us, if it's in us, or like, is it contact or is it just by being around?
We think it's a little bit of both. And we can't prove, we can't say it's definitively either or. And that's related to the very initial question with what you do with the yoga mats. How long is it gonna live on that mat? Now, because that mat is inanimate, I think it's going to last a little longer with the moisture of us and back and forth and transmittability. But it really, those are the same questions, and we don't really know. And that's a part of why we are making the recommendations that we make, so that you don't touch and increase the likelihood of spreading, and that you do wipe using hydrogen peroxide or bleach or ethanol products like that, expecting it to increase the likelihood of killing the virus, but not knowing specifically at this time how long it would last. And when washing hands, use soap. I mean, soap is underrated, but use soap. And a lot of the sanitizers may be exclusively antibacterial, but not necessarily antiviral. And so, hand sanitizing all day may not necessarily prevent spread of this. It may prevent spread of some other things, but not this. Yes. Yes. Yes.
There's an unfortunate rumor going around about ethnicity. Can you speak to that?
Well, since you brought it up, you speak to it. Give him the mic. You know, so you didn't know that was going to happen. Well, no, she's going to bring you the mic, and let her know exactly what you're thinking, because you know what you're thinking.
This morning?
That's why I know you know.
There's a rumor going around that ethnicity has something to do with you being able to contract or not contract this. Can you speak to that? Because basically,
No, I actually truly invite you to speak to it. I mean, share what you've been thinking and your thoughts with the rumor.
well, if you can catch the flu, you can catch this. If you can catch a cold, you can catch this. It's not true that the color of your skin or your ethnicity can prevent you from catching it. So don't buy into that. Be careful. Don't not take precautions. And I know how silly it sounds, but when these rumors get out there, people buy into them. Once they hit the internet, that's literally viral. So.
Well, to that end, let me ask the question. I'm curious. Had anyone thought or heard any rumors or anything about Black people? Okay, so I'm getting yeses and nos. Really? But see, but that didn't make me think that, because that's what I track. That wouldn't make me think that. Yes, but that doesn't tell me that there's a rumor out there. That's just collecting data. Really? Okay. Well, that's what has come. Dr. Hoy, do you wanna share like what you and Dr. Benjamin are doing and why that information would come to you through LDH?
Traditionally, there are hard to reach populations. Like, for instance, the younger generation tend not to watch the news as much as they get their information from cell phones. And in poorer communities and areas where resources are not adequate, people suffer from what we call the social determinants of health, and they affect how you get health care anyway. They cause disparities amongst different groups as to how they access health care, how they benefit from health care, and it's exacerbated in a pandemic situation because getting information to these groups is hard anyway. Getting information to a homeless person is harder than getting information to a person who's sitting in front of a 50-inch big screen, right, watching the news. So that's difficult anyway. So in times like this, we don't have time to make targeted communications for those populations, so we have to do it beforehand, and that's what we do in health equity and community partnerships. We try to target these groups beforehand and try to counter the effects of the social determinants of health.
And so to that end, we are at the end. as it is 1 o'clock, if there are any additional questions, I will answer. But what I was going to say is, with the gentleman for the primary care, Baton Rouge Primary Care Collaborative, I mean, some of the information we can provide, being sure that it is appropriate for the groups that you serve, even for any variabilities from site to site within your network. And health equity is an entirely different subject, and as we watch this unfold, it will be interesting to observe any variabilities in this entity as well. And so as we are looking as ODH for the virus, we are also paying attention to that. And again, I was going to speak to you about all of us. And anyone else interested in learning more about all of us. Was there one last question? Yes, ma'am.
My name is Jacqueline Brown, and I am a resident of the community. But my question is, well, first I'll say this. We have been advised to practice good hygiene, which we should have been doing all along. So I want to know is, since we are encouraged over and over every day, all day, wash our hands, do this, don't touch this or that, what are our public service facilities, specifically food services, doing? Have they been given any additional guidelines to serve the public, or is it up to us whether we should continue going or not?
I don't think it's an absolute either or. I think it's a little bit of all of that. I mean, you have to see and decide, because even if we give rules and make recommendations, again, we are not an agency that has the hand of enforcement. We can't make them do or not do anything. And, you know, even without this, there have been some places I've gone, I'm like, no, thank you, I think I'll leave. But so I think you have to just decide if you see how people are handling the food.
Yeah, but my question really is, are any additional guidelines being given to them, or they're just running off of the regular guidelines that they have right now?
Yes, guidelines are given, but that's all we do. We can give them. We cannot enforce them. We can't make them.
Since the coronavirus.
Yes, ma'am.
Okay.
But we can't make them enforce it. So you may still see some things that can be questionable, but it doesn't mean they weren't given. It just means we are not able to enforce. But sanitarians are under LDH, Office of Public Health, and the people who do the restaurant inspections. This was really interesting. I didn't get through half my presentation, but this was fun. Thank y'all. I hope, though, more than fun, I hope it was informative. Thank you. And thank you. And because this is evolving, if you have other questions, the last slide really was my contact information somewhere in here. I really had some stuff to say. Oh, wait, that's it. So if you want to get that email address or call the general office line as we learn more, as things evolve, just remind me you were here.
Excuse me.
Yes.
Will that presentation be made available to participants or?
That wasn't initially the plan, but it doesn't mean it can't be. I mean, are you interested?
Yeah,
Okay.
I'd like to get a copy of that, because since we didn't get through it, there may be some
Okay.
information people need.
The only thing with that is that be clear that this is accurate for today. I would have to change this evening for a presentation tomorrow morning. And so what may be better than this actual slide presentation, because of the fluidity of this situation and the fact that it is actively evolving, it may be better for me to just provide you with some of the LDH information that we have that is stable right now. And again, hold on to this information, or you can go to the LDH website as well, ldhla.gov, because some of this will be outdated tonight by sundown. but I still want to have it accessible and available to you for any questions you may have. Thank you.
Can we give Dr. Dawn Marcel another round of applause? We thank you so much. Thank you, Dr. Wilkes, for serving on our panel. Thank you, Al Harrell, for hosting this event. We do have lunch, and it'll be served right outside when you exit the door, so we have lunch available for you. This is the beginning. As we learn more, as Dr. Marcel said, this is constantly evolving. We will make every effort to bring you the latest, updated information to you. We thank you for coming, and enjoy the rest of your day.